Dear learners, welcome to this MOOC on Sociology of Health and Illness. This is the Unit 19 of the Module 6. In this video, we will discuss about some of the community health problems in India and strategies to deal with it. There are a number of health issues that had or has impacted most members of different community in India. Some of the common communicable diseases are Kala Azar, malaria, filaria, Japanese encephalitis, tuberculosis, dengue, leprosy, etc. The government of India has been able to eradicate or control many of these communicable diseases by delivering medicines through planned programs and delivery of requisite medical care. However, certain diseases like Japanese encephalitis, dengue still requires strict monitoring and surveillance to curb the spread. Some of the non-communicable health issues are malnutrition, high maternal and infant mortality rate, blindness or vision impairment, iodine deficiency disorders, sexually transmitted diseases are some of the concerns affecting huge number of people in different communities in India. Again, in the recent times, mental health has also been identified as an issue that needs attention at the community level, and therefore the National Mental Health Program and Health and Wellness Centers intends to provide quality care at the primary health care level. Then comes cancer. Cancer is a major public health concern in India. Cancer prevention, screening, and early diagnosis are one of the most cost-effective and effectuous measures to prevent and control the cancer burden in India. India has recently launched the Ayushman Bharat program. This program focuses on strengthening primary health care through health and wellness centers, and the Pradhan Mantri Jan Arogya Yojana intends to provide secondary and tertiary levels of treatment services. The health and wellness centers focus on community-based screening for some of the common cancers. Now let us try to discuss the strategies to deal community health problems. Recognizing the importance of health in the process of economic and social development and improving the quality of life of our citizens, the Government of India had launched the National Rural Health Mission to carry out necessary steps to provide basic healthcare delivery system. The mission adopts a synergistic approach by relating health to determinants of good health like requisite nutrition, sanitation, hygiene, and safe drinking water, etc. It also aims at mainstreaming the Indian systems of medicine to facilitate healthcare. Accordingly, the plan of action of this mission includes increasing public expenditure on health, reducing regional imbalance in health infrastructure, pooling resources, integration of organizational structures, optimization of health manpower, decentralization and district management of health programs, community participation and ownership of assets, induction of management and financial personnel into district health system, and operationalizing community health centers into functional hospitals meeting Indian public health standards in each block of the country. So dear learners, to contain diseases that impact vast majority of people in a geographical area, along with the help of outside agency, whether public or private, the awareness and the organizing capacity of the community is very important. Now let us try to understand about community organization in detail. The term community organization in general means helping the community to solve their problems. It is a process in which the efforts are directed towards meeting the community needs by developing integration within the community. The term community organization became an important concept in the social work profession due to the publication of the Lane Committee report in 1939, which identified community organization as a method of social work. Following are some of the important definitions of community organization formulated by different thinkers and practitioners. Lindemann in 1921 defined community organization. He said, community organization is that phase of social organization which constitutes conscious effort on the part of a community to control its affairs democratically and so secure the highest services from its specialists, organizations, agencies, and institutions by means of recognized interrelations. Then Murray G. Ross in 1955 defined community organization as a process by which a community identifies its needs or objectives, orders or ranks these needs or objectives, develops the confidence and will to work at those needs or objectives, then find resources, whether internal or external, to deal with these needs or objectives, and then finally take action in respect to them. And in so doing extends and develops cooperative and collaborative attitudes and practices in the community. Walter W. Pettit in 1952 defined community organization. He said community organization is perhaps best defined as assisting a group of people to recognize their common needs and helping them to meet those needs. Summarizing the above definitions of community organization, we can say that community organization is that process in which a community is helped to identify their needs and to solve their problems with the available external and internal resources in organized and cooperative manner. Now let us try to know the historical background of community organization. The community organization process has been used extensively both in developed and developing countries. Since the time people lived together as community, some organization became necessary. With the time, when the life became more complicated, some formal organizations were set up for the welfare of the community. The Elizabethan Poor Law in England was one of such efforts to provide services to the needy. The charity organization societies can be said as the forerunners of modern community organization process. They were first organized in London in 1869 to eliminate indiscriminate alms given by the relief agencies at the time. In America, the first charity organization society was organized in Buffalo in 1877. Later on, these were organized in Pennsylvania, Boston, New York, Philadelphia, and other places. The basic purpose of these societies was cooperation between all charitable agencies of a given locality and the best coordination of their efforts. They also organized a number of other activities, employment bureaus, day nurseries, etc. The settlement house movement was another landmark in the beginning of community organization. Beginning with the establishment of Neighborhood Guild in the Lower East Side of New York City in 1886, the movement spread rapidly in all industrial centers. James Adams Hall House in Chicago and Mary Schimbock's Greenwich House in New York City were among more famous settlements. The American Red Cross Home Service Program began during the World War I and had the concept of professional social work in its practice. At the same time, many other agencies like YMCA, the Boy Scout, the Girl Scout, and the Campfire Girls began extending their programs to many communities. Now let us try to know the aims and objectives of community organization. The general aim of community organization is to bring about and maintain a progressively more effective adjustment between social welfare resources and social welfare needs. It is concerned with the discovery and definition of needs, the elimination and prevention of social needs and disabilities, and then the articulation of resources and needs and the constant readjustment of resources in order to meet the changing needs. Some of the other objectives are: firstly, to secure and maintain an adequate factual basis for sound planning and action. Then, to initiate, develop, modify welfare programs and services in the interest of attaining a better adjustment between resources and needs. Then we have the need to improve the standards of social work and to increase the effectiveness of individual agencies. Then to improve and facilitate interrelationship and to promote coordination between organizations, groups, and individuals concerned with social welfare programs and services, and to develop a better public understanding of public problems and needs and social work objectives. Another objective is to develop public support of and public participation in social welfare activities. Then finally, the objective is to generate financial support. It includes income from tax funds, voluntary contributions, and other resources. There are several phases in community organization. Let us try to know those. Phases generally means any distinct time period in a sequence of events. It is also called a short unit of time or an episode of development or change, usually within the context of a longer period. So let us discuss the phases in community organization process. First of all, study and survey. Study is the application of mind to the acquisition of knowledge and by reading, investigation, or reflection. In community organization, study is the personal effort to gain knowledge and to understand the community. The term survey derived from two words, that is sur, to see a particular thing, and vor, from a high place. Now, community survey is a method by which quantitative facts are collected about the social aspect of a community's position and activities. By survey method, the community organizer can assess the existing services and resources in an area of need as well as the gaps in service. Surveying both service agencies and community residents, asking them how they perceive their unmet needs, can identify the potential demand for services. The next phase is analysis. Analysis is the process of breaking a complex topic or substance into smaller parts to gain a better understanding of it. Analysis is the application of the 6 basic analytical questions, that is what, whom, where, when and how. What is the problem? Where does it exist? Who is affected by it? When does it occur? What degree it is felt? Analysis lies midway between fact-finding and planning. It involves collection of data, exploring the content of the data, breaking up the content or problem, examining the interrelationship between the constituencies. The purpose of analysis is to gain insight and understanding. Planning can scarcely exist without analysis. A sound plan normally implies that the planner has the facts and that the facts and the problem has been analyzed as a basis for formulation of the plan. Then comes assessment. The meaning of assessment is classification of someone or something with respect to its worth. Assessment is extremely important to know the community where the community organization would be working in and the history of the issue he or she would be addressing. At least 2 to 3 months are needed to become familiar with the community, its history, makeup, demography, geography, and the political leadership. The community organizer should continue to learn about the community by going door-to-door knocking and conducting one-to-one interview or conversation. The organizer must learn what the community members' concerns are and find out what they identify as problem, and not tell the community what they perceive as the problem is. Then comes discussion. After having assessed the community and the resources available within the community, a platform for discussion is made by the community organizer. The community organizer involves the community leaders and the community members in the discussion. The problems of the community are shared and discussed. An action plan is made to be implemented by the community. Then comes organization. According to Dunhun, organization means orderly arrangement of the group effort to provide utility of action in the pursuit of a common purpose. Now, one should remember, when we organize the people, we must understand their level of awareness. And the level of awareness can be different. It can be naive level of awareness. For example, the people are aware about the problem of poverty. Then comes critical level of awareness. For example, the people may know the critical aspect of the problem. For example, land is available, but it is lying waste and dry. Then comes the organizational level of awareness. Now, people may be aware about their need to organize, but they might not have enough idea about how to organize themselves. Now, when a community organizer organizes the people, one must be aware how the people in that particular context are used to working and about their organization in the past. For example, small farmers may not adjust easily in a large cooperative firm where work is organized based on expertise. Then factory workers who are accustomed to division of work may not adjust in a small organization where division of work is not followed. In the process of organizing, the organizer facilitates people's participation in the following ways. Firstly, choosing the right person for the right job, providing substantial representation. Then to develop the organization, there should be selection of volunteers or indigenous non-professional aides, coordinators, contact persons, etc. There should be leadership training. Then there should be socialization or motivating the people regarding the need to organize themselves and to act towards that. To understand the organizational structure, one should learn the organizational roles, understand who is who, what is what, why is why of an informal activity, identify the human resources to get information and advice, cooperation or help, understand the existing power structure. And after these process comes the action. Action is a process or condition of acting or moving. After having organized the community, the plan is implemented into an action. The implementation takes care of the time and resources towards fulfilling the fixed goals. While implementing the plan of action, the involvement of the people and their active participation by accepting the responsibilities has to be ensured. The people have to be prepared and guided to become a partner in problem-solving approach. Then comes reflection. The implemented plan then needs to be evaluated to find out the success and the deviancy of the action from the objectives. Any deviancy or any undesired results are identified and the reasons for the deviancy is discussed. The positive and the desired results are to be appreciated. The evaluation can be made as one of the components of working with the community. It could be organized either at periodical level or at the end of the activity, either within the organization, by the organized personnel, or by an outside or by an expert. The task is not complete unless the evaluation is completed. Then comes modification. Modification is a partial or slight change in form. Based on the evaluation, modification that is needed is decided and introduced. In order to bring a permanent solution to the selected problem, it is being addressed with the modifications. These modifications are proposed in order to settle the problem permanently. Then the modified action plan is implemented and continued. So dear learners, in this audio video, we have discussed about some of the community health problems in India and the strategies to deal with it through community organization. By being aware of the steps involved in community organization, we can take the leadership to organize our communities against diseases and ensure quality living. Thank you.